Hello, my name is Kyle Dillon, and this is my individual ethics case analysis for Walsh University's MBA 621 Sustainable Ethical Leadership. So, a bit of background on the scenario. In 2012, I was a nursing student in a semi-local unnamed hospital. A patient, 90-year-old female, presented chronic pain and low level of consciousness. She complained of pain in both hands around her knuckles and was starting showing signs of early dementia. There was a surgery scheduled to replace the cartilage in her knuckles. So the patient initially had provided consent for the procedure, but is now wavering on and off, kind of flip-flopping on the consent, but is still complaining of the pain and is also now refusing medication to help treat the pain. The patient's daughter has durable power of attorney in a case like this and does not want the surgery. She thinks it's too risky, too dangerous, and is worried for her mother's wellness in general. So let's break this down ethically. In every scenario, the hospital absolutely needs to receive informed consent from the patient or the power of attorney. So we need to ask ourselves, can the patient provide informed consent? Can the patient's power of attorney provide informed consent? And what is the nurse to do? In order to help make this decision, we're going to use the generalizability test. What the generalizability test breaks down to are these two factors. Can you defend your reasoning applying the same decision to many other scenarios? And are you comfortable with this happening to you and many others in general? So now the nurse asks themselves, does the nurse, A, sign off on the surgery having received the most recent version of consent from the patient? Does the nurse side with the power of attorney and just outright refuse the surgery, citing the family's concerns? Does the nurse get frustrated and quit? Or does the nurse educate and inform? This sounds like it should be an obvious one, but the nurse should educate and inform. We were taught this over and over again in Walsh's nursing program, that patient consent and patient willingness to continue is the utmost deciding factor in any scenario. You don't treat them unless they're giving informed consent. They need to know the procedure and they need to consent to the procedure. And it's a classy decision all around. So to analyze this, we will use ethical leadership theory. The ethical leadership theory states that leadership is seen as a full player in the moral disclosure, as seen in figure 5.1 of our book. I've attached a very crudely scanned version of that down below. Our book also states that the very idea of leadership cannot be stated without ethical judgment. So the recommendation for the case is, my recommendation would be exactly how the situation played out. The nurse sat down with the patient and sat down with the power of attorney together, explained the procedure, explained the benefits, and explained the risks. As it was just a knuckle replacement surgery, just replacing the cartilage, there were relatively low risks. Infection. The hospital is very good at things like this. Throughout this process, the patient was comforted. The power of attorney and the patient together selected to receive the surgery, and all in all, the optimal outcome was achieved. Why do we do this? Well, our book also states that the upside to positive action is that fostering good relationships with other stakeholders does lead to increased shareholder returns. In general, the way this applies to the hospital is that if the patient has a positive, good experience, they're going to come back. You're going to achieve maximum possible wellness for the patient, their livelihood, and their loved ones. And that's it. I'd like to thank you for sitting down with me and watching this. And yeah, thank you. Have a good night.